Now from KWWL, this is the Steele Report.
And welcome to this week's edition of the Steele Report. As you can see, Elizabeth has joined me for this week because we are going to be talking about Iowa's ongoing fight against cancer. And Elizabeth has been doing a series of reports all week long on our newscast, and we're going to show you some of them again today. The good news in this, there's 168,000 Iowa cancer survivors, but unfortunately there will be 21,000 new cases just alone in Iowa this year. So why did you decide, what attracted you to this particular story?
So those numbers obviously are very alarming, and you know the report on this, that Iowa had this cancer problem first came out in the fall, and actually this is the second year that Iowa ranked second in the nation for new cancer cases, and our cancer rate is also rising, and there are not many states that have a rising cancer rate, and that really struck me as well. So, you know, this is my home state, and I don't like seeing my friends and my family members getting sick, and it is such an overwhelming problem, and I just wanted to give people some practical tools, expert advice to try to get a handle on this cancer problem. So I first started with an amazing resource that Iowa has. It's called the Iowa Cancer Registry, and they are tracking all the cases across the state and have a wealth of information about what types of cancer are most common and where they're most common. So I asked their director, what's to blame for Iowa's alarming number of cancer cases?
From miles of picturesque farm fields to the hustle and bustle of an iconic state fair, Iowa is known for plenty of positive things. But lately, our state is also at the center of a deadly problem.
Well, unfortunately, in the most recent 5-year reporting period, we are once again number 2. So we have the second highest cancer incidence in the country, and we are only one of 2 states with a significantly rising cancer incidence rate.
University of Iowa professor Mary Charlton leads the Iowa Cancer Registry.
I think people are scared. It's scary to hear that you're in the state with one of the highest cancer rates, and that continues to increase. And it seems like everybody knows somebody with cancer. It touches everybody.
So where is Iowa's cancer problem coming from, and what can we do about it? That's where things get complicated.
Lung cancer, we see the highest rates of that in the southern part of the state. Prostate cancer, we see the highest rates of that in the western part of the state. There's some cancers we see more along the Mississippi River. So it's so variable for each type of cancer, which is why, you know, it can't be just one thing.
Well, there's no one thing causing Iowa's high cancer rate. Dr. Charlton says there are a lot of things known to be contributing to the problem. Tobacco and alcohol use, poor diet and lack of physical activity, chemicals like pesticides and weed killers, as well as our environment, including the sun and radon.
We hope that people are open to talking about all the different things, and instead of sort of pointing fingers or, declaring it's one source that's causing the cancer, to really understand that it's not one thing. It's all the things we have to work together to do something about this so that this doesn't keep going for years and years and we don't become the state with the highest cancer incidence rate in the country.
So the Iowa Cancer Registry is creating county by county reports to try to get the word out on the specific risks in each part of the state when it comes to cancer. They're also going to be holding informational meetings about this in the coming months. It will all be available online very soon so people can really try to zero in on where they live and what some of the biggest risks in that particular area may be.
So let's dig into some of the biggest risks for Iowans.
Yeah, so there are a few big ones, and the one we decided to start with is alcohol, because it is one that a lot of people simply don't realize the connection to cancer. They know drinking a lot of alcohol is not good for your health necessarily, but they don't realize it causes cancer. We are a heavy drinking state, one of the heaviest in the nation. We like our tailgating at football games, but unfortunately, the research now shows that alcohol causes cancer.
That was really an aha moment.
That aha moment for John Stokes came during a recent call with his doctor, connecting the dots from his past as a former alcoholic to his present as a 2-time cancer survivor.
The first thing I thought of is, really? I didn't know that. And, so that was kind of a revealing moment.
Like many Iowans, he didn't know consuming alcohol was linked to cancer.
Most people don't know that connection between alcohol and at least certain cancers.
Dr. Paul Gilbert at the University of Iowa says alcohol is one of the top preventable causes of cancer.
alcohol is a carcinogen and is classified as a carcinogen. And this is really significant. This is pretty important because it's hard in science to establish causal relationships a lot of times.
And while we can't point to one thing causing Iowa's high cancer rate, experts say alcohol consumption certainly plays a role.
Iowa tends to, if not lead the nation, to be right up there. We are consistently above the national average for binge drinking.
Alcohol is specifically linked to cancer of the mouth and digestive system, as well as breast cancer.
Cancer's not fun. Cancer will kill you, and depending on what type of cancer you have, it can be debilitating. I mean, the fact that my voice is raspy is a aftermath of having cancer on my larynx.
But experts say even small changes can help reduce your cancer risk.
If those current drinkers just dialed it back a little bit, had one less drinking occasion or one less drink on a day that they drank, that adds up to a pretty big effect over the state at large.
And for more motivation, Stokes puts it like this.
Do you want to trade that for less years or a painful death? And that's really what you're doing.
So there's an effort on the federal level now to try to address this alcohol issue. The U.S. Surgeon General is just recently now calling for cancer warning labels on alcoholic beverages. Congress would, of course, have to approve that first, but the idea would be to just make people more aware of that risk.
Tobacco, that is another huge risk. Tobacco is definitely very, very dangerous still for too many Iowans.
Yeah, certainly still an issue here. Iowa has a lot of drinkers and we have a lot of smokers, unfortunately, about 1% to 2% over the national average. And people seem to know that smoking causes lung cancer, but it is actually linked to a variety of cancers. And in this story, we're going to hear from John Stokes once again. His cancer risk didn't stop with alcohol.
John Stokes of Iowa City was shocked to learn his former alcoholism may have played a role in his 2 cancer diagnoses. But that wasn't the only risk factor he was up against.
Quitting smoking was so much worse than giving up alcohol by a major factor.
Stokes had smoked several packs a day for years, and even now, decades after quitting.
And I will still get that feeling that I need to have a cigarette. I mean, it's really surprised me.
Data shows up to 14% of Iowans smoke on a regular basis, and most know it's not a healthy habit.
People know that it's harmful, and probably 85 to 90% will tell us that they know it's linked to cancer.
But many don't know it's linked to much more than lung cancer, according to U of I professor Mark Vanderweg.
There's 11 other cancers that are linked to smoking, and it can include things that folks may not think about. So things like pancreatic cancer and cervical cancer, liver cancer, bladder cancer, and many others are also linked to smoking.
And he says there's no way to make up for that risk with other healthy habits.
There's folks who will have the misperception that, well, if you're physically fit, if you exercise, if you eat well, if you take vitamins, those kinds of things, then the risk of smoking is lessened, and that just is not the case.
But quitting can be a long and painful battle. For Stokes, it came down to a decision on his 50th birthday.
I decided that would be my last one, and man, I tell you, months, it was terrible. It was just awful. What I would say to myself is, okay, it feels so bad, and I want this so bad, but I won't do it, and we'll see what happens. And then I didn't die. And that would get me a little bit further down the line, and that would happen over and over again. It just feels so terrible. I got to get rid of this feeling, but then I didn't die.
But experts say once you do quit, the benefits can be dramatic. The risk of head and neck cancer drops off as much as 50% within the first 5 to 10 years.
Yeah, so this is another of the big foundation pieces for preventing cancer that I kept hearing from all of the experts that I interviewed over the course of these stories. Eating right, getting physical activity are just so important. And it doesn't necessarily have to be formal exercise, but just physical activity. And again, this is unfortunately an area that Iowans are having trouble with. Data from the CDC shows that 26% of Iowans get no physical activity on a regular basis outside of their jobs. But experts say how much you move your body could not only impact your risk of developing cancer in the first place, it can also help you survive it. And I talked with an Eastern Iowa cancer researcher who found this out during his own brush with cancer.
For Keith Train-Borowski, it all started with a sore throat that just wouldn't go away.
This was the worst sore throat that I've ever felt in my entire life. And I couldn't figure out why this hurt so bad.
After 5 months without answers, the Loras College professor consulted a specialist and friend who gave him the awful news.
He leaned over and said, I think you're right. I think you have cancer. And it's strange because whenever you hear those words, it's life-altering, frankly.
A life-altering diagnosis he knew all too well. As a researcher, his work focused on cancer patients and how exercise can help them recover.
Recent as the 80s, oncologists were telling patients, no, you should be lying down, resting in between treatments. You got to save your energy. And we now realize that that's probably the opposite of what should be happening.
Now he had a chance to put cutting-edge research to the test. Already an avid runner, he started timing his workouts to run up to the moment each radiation treatment began.
I'd get done right at the doors of the hospital. So I'd walk, into the hospital, go to the radiation oncology unit, dripping wet, and, they'd take me back and I would jump on the radiation table just like that.
The idea was to increase blood flow to the tumor, giving the radiation a better target. Now, 2 years in remission, he says he has no doubt the hard work was worth it.
When you see the data tell you it's important and you know this and it's your job and you're trained to do it, and I see it in my own patients, but then once I saw it in myself, as if I wasn't convinced before, it's pretty powerful.
Really fascinating story. And how is Keith doing?
Well, he's been in remission now for a couple of years, and so very thankful, and hopefully it stays that way.
Yeah, wish him the very best. We're going to take a break, short one here on the Steel Report. Come right back with more in just a moment. And another thing we really don't think about that often is Iowa's a geographical location in the world, and it just so happens that January is Radon Awareness Month, so I think it's pretty obvious where we're going with this particular segment.
Yeah, sure. A lot of people maybe have heard of radon, but there's also a lot of people who have never tested their homes for it, and it can be a real risk for cancer. And what's really unnerving about it is that you can't see it, smell it, taste it. There is no way to know if you have a problem with it in your home except to test for it. And unfortunately for some Iowans, this testing is coming too late.
For Maria Steele, the trouble started with a cough that just wouldn't go away.
I mean, lung cancer was the very last thing on my mind. I mean, I had never smoked. My parents didn't smoke. I was in nursing, trying to do all the healthy, right stuff.
But despite her best efforts, something had slipped through the cracks. She believes, quite literally.
I had heard of radon. I didn't know it was that 3/4 of our homes in Iowa have high indoor radon levels. We had never tested our home.
As states go, the EPA says Iowa is among the worst when it comes to radon. This map shows the entire state as having dangerously high levels.
Radon is a decay product of uranium, believe it or not.
Julie Weishar runs the Energy Association of Iowa Schools, which works to help districts across the state test for the dangerous substance.
It is a carcinogen. So when it gets to the point that it's radon gas, that decays into little dust particles, kind of, and you breathe those in and they get stuck in your lungs. So it's cumulative throughout your lifetime.
An Iowa law passed in 2022 requires all public schools to test for radon. Weishar hopes that it will help spread the word across communities about the importance of testing.
We want people to be as safe from radon-induced lung cancer as they can. And the only way you know, since radon can't be seen, heard, smelled, you really have no way of knowing it's there unless you test.
It's something Steele wishes she could have done long ago.
I think it was $12. And it's just this at-home test kit that you can do. And you send in the results, and I think it was a week and a half later, it came back that it was double what it should be.
While she was able to fix the radon levels at home, the battle to repair the damage she suspects it caused to her body continues.
The real thing that was the hardest thing was being told I had metastasis to my brain after the brain scan, because I had had no symptoms. They're like, do you get headaches? No. Do you have dizziness? No. No symptoms at all.
In the 5 years since her diagnosis, Maria has worked to raise awareness about radon and lung cancer at the Capitol and beyond, even riding bikes with her husband across the country, giving thanks for every breath along the way.
So things are in flux. But life is in flux for all of us on different levels, right?
So again, testing is the only way to know if you have high radon levels, and the tests are not expensive, less than $20, as you heard there, and counties across the state are holding events this month for Radon Awareness Month to explain just how to test properly, so you can check with your local health department for those events. And the repairs, if you do have high radon levels, they can be a bit more costly, but if you plan on staying in your home for years, it's probably worth the price to protect your health.
Maria and I don't think are related, Maria Steele,
We should know
but I
that,
just
yeah.
love what she said there about life is in flux. It's just, that is so true, and her attitude obviously is fantastic,
Such a
so we
positive
really do
attitude.
appreciate that.
Well,
So,
yeah.
and it's not just, we're talking about radon, it's not just what's below ground here in Iowa, it's all around us, things overall in the environment.
Yeah, another piece to this puzzle. And when I started digging into the environment part, I started with sun because, as you mentioned at the beginning of the show, skin cancer is such a problem for so many people here, especially those who were born before there was knowledge of just how damaging the sun can be.
I grew up in a time when being tan was really perceived to be healthy and attractive.
Carla Lubenthal remembers soaking up the sun in her youth, never realizing decades later she'd be paying a dangerous price.
I think the last time I went in, I said, how many more of how many more scars or how many more times am I going to have to do this? But actually, as I've aged, they're coming more often.
Spots of skin cancer, and the worst kind, melanoma. And here in Iowa, Lubenthal is not alone.
Iowa has really been put on display because within that deadly type of skin cancer, Iowa is now the 5th in the nation for incidence of melanoma.
Dr. Jennifer Powers says exposure to UV radiation from the sun is a major risk factor for skin cancer.
We have a lot of patients with lighter skin who are at risk for burns, and burns is a significant factor for whether someone will get skin cancer.
But as anyone who's survived a winter here knows, Iowa isn't a state of endless sunshine. That's why Dr. Powers says she thinks there's more to Iowa's skin cancer story.
If it was just UV alone, it would be Texas, it would be Florida, it would be California. And we know that that's not what the statistics show.
She says researchers need to consider other factors at play in Iowa as well.
And we don't know yet, do pesticides contribute? We don't know if other environmental factors, other chemicals, certain occupational exposures, whether those contribute, but we are actively trying to understand that.
In the meantime, Carla is having her 11th melanoma removed.
They do an excision, a wide excision, and I have 10 scars on my arms and legs and back.
Scars from a battle she hopes others will be able to avoid in the future.
Sometimes we just ignore the skin, but it's our first layer of protection from the outside environment. So we really need to take care of it.
So when you think about the environment in Iowa and what makes our state unique, obviously, is the amount of corn that we grow. And in many cases, we use a lot of chemicals to do that. So there is growing concern and curiosity now in the face of this rising cancer problem here to really start to look at a possible connection to chemicals involved in agriculture.
For the past 30 years, researchers have been checking in on thousands of Iowa farmers through an effort called the Agricultural Health Study. Farmers like Keith Cooper.
They've come out to my farm and sampled soil, water. They've taken soil samples off my equipment and so forth.
Participants farmed conventionally using pesticides and other chemicals to grow their crops.
We do that to control weeds, insects, get higher crop yields, that type of thing.
But the study is showing that strategy may be coming at a price. The farmers involved have had a higher rate of prostate cancer, one of the most prevalent cancers in Iowa. It's something Kamyar and Cheyenne knows a lot about in his own recent battle with the disease.
One of the first questions in the questionnaire that doctors asked me was, did you work on a farm? That was number one.
He did not, but he spent the past 30 years teaching at UNI about agricultural practices to improve Iowa's soil, water, and ultimately, he believes, our health.
The way the process is right now, hazardous chemicals for which we have compelling evidence that they should not be used, they're still on the market, they can be applied.
Glyphosate is one chemical under scrutiny in recent years, used in products like Roundup to control weeds. In the U.S., the EPA says glyphosate is, quote, unlikely to be a human carcinogen. But the International Agency for Research on Cancer, part of the World Health Organization, calls it, quote, probably carcinogenic to humans.
So we're in this space of having disagreement between some of the major agencies that make these designations.
U of I Associate Professor Brandy Jansen says nitrogen applied to fields in the form of anhydrous ammonia or manure is another area of concern.
When that nitrogen gets into the environment and when it gets exposed to water, it can transition into nitrate, and that nitrate can be carried out and then consumed, right, if it's in drinking water in particular.
Research shows nitrates are linked to an increased risk of bladder, colon, and ovarian cancer.
The way that chemicals cause cancer isn't like you drink a chemical that's carcinogenic once and it ends up causing cancer.
Dr. Richard Deming has spent decades treating Iowans with cancer. He says when it comes to our state's cancer problem, there are many factors to consider, including how we use chemicals.
When you look at an aerial view of Iowa and the amount of chemicals that get spread across Iowa to improve our crop production, it's logical to ask, what is the contribution of ag chemicals to the high incidence of cancer in Iowa?
The dark green on this map from the U.S. Department of Ag shows states with the highest corn production. The dark blue on this map shows areas with the highest rates of cancer.
There is no doubt that ag chemicals enhance agricultural yield and production, so there's benefit, but the benefit comes with some risk as well.
But quantifying that risk remains challenging.
We are one of the minority of states in the country that doesn't really invest public money, state money, into research on causes of cancer.
He hopes Iowa's alarming ranking will change that. In the meantime, for those in the fields of Iowa and beyond, a way of life and life itself may be hanging in the balance.
I've been fortunate, so I'm in reasonably good health. I suppose I could change any day, but so far so good.
So the next obvious question might be something like this: how do we protect ourselves from all the chemicals that we're seeing?
Yeah, so in the meantime, what you can do to protect yourself, experts say just avoid using unnecessary weed killers on your lawn, or encourage your child's school to avoid using them. And when it comes to nitrates in drinking water, the best route there is a reverse osmosis system to filter the water. And then, as you heard some of our experts talk about, you have to let your local lawmakers know your concerns, because ultimately a lot of the funding for research is up to them.
Yeah, everything goes through the legislative session, and a lot of families are preparing to do just that, let their voices be heard.
Yeah, there is a group of parents from Northeast Iowa headed to the Capitol next week to talk with lawmakers there. They've all had children who have been impacted by cancer, and I will have more on their story coming up next week as the legislative session is set to get underway.
Yeah, really important for those folks to let their voices be heard at the legislature in Des Moines. Another short break here on the Steele Report. We'll wrap things up in just a moment. And welcome back as we wrap up this week's edition of the Steele Report. Thanks a lot to Elizabeth for taking the time to come on the show. And I really do want to ask you before we go, though, doing all this research, what was your biggest takeaway from this kind of Iowa cancer crisis?
Yeah, well, I mean, it's clear that there is no one thing that we can blame for the problem, and it's going to take a group effort to try to address it on the personal level, on the community level, and on the policy level as well. And you know, we talk so often in the fall during football season about the Iowa wave and what a wonderful, amazing thing that is. And one person I talked with said, just think if we could put the energy of that effort into the effort of trying to not have kids having cancer treatment up there in the first place to try to prevent it.
Absolutely, but there's some incredible research going on in Iowa City and around the world right now as far as cancer, so we appreciate everything that everyone is doing. Unfortunately, we are out of time for this week's edition of the Steel Report. As always, thanks for watching. We'll see you back here next week.